The Italian healthcare system. How different is it really? Hey, what's up, friends and foreigners? I'm Rafael Di Furia, aka Rafi D is me, and I'm not your average gringo. So whether you're coming to Italy for a short little trip, or you're planning to actually become a citizen or a resident of Italy, it's good to know kind of how things work out here. Today, we're going to be going just into a brief overview of how the medical system here in Italy actually works, how to use the system. Before we get started with this video, if you want to see more content like this, be sure to make sure you are subscribed with the notification bell on and that you like the video. I'm not any kind of legal expert or advisor or authority on the matter, but these are just some of the basic things that I've seen. And any of this information could change at any time, so always double check if you feel as though there is a need to know. But this information, I would assume, should be relevant for a while. One thing to keep in mind is that I will mention a few prices during this video, but those prices can change depending where you are in the country. First off, if you're not a citizen of Italy or a resident, you're just here for a quick trip, just know that that does not exclude you from being able to access Italy's emergency services. While there are plenty of people who come here without insurance, I wouldn't recommend necessarily following in their footsteps. Better to have your butt covered than not, literally. But if you are going to be here for a while, you especially need to make sure that you are covered. And if you're looking for any sort of insurance as an expat traveler or whatever for yourself or for your gear, stick around to the end of this video because there's this great website that I recently found. Italy has been ranked number 2 by the World Health Organization, just behind France, and the system here is mixed between private and public. You do have fully private insurance available, however, we're going to only be talking about publicly available services. There are services which you do have to pay for, but there are some services which you actually don't have to pay for. For example, trauma care, in theory, is not actually supposed to cost anything at all. And unless I'm mistaken, it's actually covered under Italy's constitution that anybody who needs medical care can get it. Or there are instances when you go to the ER where it can cost you, but not as much as walking through the door back in the States. Even if an ambulance is needed, in many cases, you don't actually have to pay. But we'll go a little bit more into emergency services later in the video. If you are wanting to become a resident or if you are becoming a citizen of Italy, just know that there are even more services that are free. For example, going to a GP, general practitioner, family doctor, those visits, zero cost. And having children in Italy, that's also supposed to be free. But when we're talking about doctor's office hours in Italy, this is probably the one thing that's a little bit stranger than bank hours. Also, different doctors have different ways that they work. Some doctors don't accept any appointments and it's only walk-in services, whereas some other doctors you will have days or times of day where it's only walk-ins and times where it's only appointments. But just a quick example, my doctor doesn't accept appointments. You have to walk in. How does that work though? You go in, you go sit in the waiting room. Some doctors have numbers you can take, but many don't. And it goes at this point just by the honor system. I have heard about some places where people do kind of try to get ahead, but in my experience, I've not had any problem with this. You just ask, who is the person who was last there? And it's just that easy. But there will potentially be a wait, and that wait could be a little while. The longest I've ever waited was about an hour, but I've also waited 5 minutes before. Depends on the day. But if you only need a prescription renewed, that can actually be much quicker. What happens usually is that in between patients, the doctor will come out, they'll ask if any prescriptions need to be renewed, and they'll take it, and then when they come back out of the room again, you'll have your prescription ready to go. So this way you don't have to wait as long as somebody who actually needs an appointment. But one other big difference with going to the doctor here in Italy, if you're on the public services and not a private doctor, the whole idea of getting a checkup isn't really normal here. This is just my opinion here, but it seems as though the system is so overworked and the doctors just have so many people that they just need to kind of get them in and out as quickly as possible. And there also seems to be a mentality that you only go to the doctor if you need to go to the doctor. However, I have heard from other expats that if you really do need a checkup for whatever reason, and you ask very nicely, you may actually have a chance of getting one. You might get lucky and find a doctor that speaks English, but there are plenty that don't. Another reason why I keep saying in my videos, learn the language. And if you want 5 quick tips on how to learn any language, check out my video down in the more info section below. Yeah, on with the video. All right, going back to the ER. Not back to the ER, but you get what I mean. Going back to that subject, in Italian, the way that you say ER, emergency room, is pronto soccorso. Literally, it just translates to first aid. The way that the Italian ER works is a little bit different than in the States, but the way that it works, hopefully assuming that you didn't come in an ambulance, is that what you'll have to do is you'll go in, you'll check in, and once you've given them the basic information, you'll be given 2 things. You'll be given a priority level and a number. Basically what happens is you wait first until your number is called, and what happens is you go into a room, you'll talk to a nurse, and you'll describe what happened, how it happened, what the injury is, and any other relevant information about your health, if you're allergic to anything, or whatever. Then after that, you'll go back out into the waiting room and wait again until they call your number again, but then they'll bring you into whichever area you need to go into. To go into the priority levels a little bit, just so you have the basic idea of how that works, there are 4 levels: red, yellow, green, white. Quick explanation of what those priority levels actually are is red basically means the patient is really in serious danger and at very serious risk of losing their life. Potentially they aren't even conscious when they enter. Yellow means immediate attention is required. However, within about 10 minutes, they're not going to be at any immediate risk of losing any vital functions. But green is more if you have like a simple break or a sprain or things that are a little bit easier like that, where your life is not at any kind of immediate danger. But white basically means there's no real necessary reason why you should be there. They don't say that, but that's basically what I've been told. Pretty much it means that you should have just gone to your regular doctor for regular medical services. And to my understanding, the way that the fee system works is that if you come in with red or yellow, that there's no cost. However, if you come in with a green priority level, in my region of Alto Adige, it costs 15 euros. That means walking in the door, seeing the nurse, seeing the doctor, and potentially x-rays for 15 euros. Whereas just going to an ER back in the States, just for breathing the air in the waiting room can cost you a couple $100. And it should be more or less the same around the rest of the country. However, some things in Alto Adige function a little bit differently. But if you come in and you have a white priority level, that means you're at risk of a fee between 50 and 100 euro. But just to go on to one last quick thing, what if you're living here and you go to your GP and they say, hey, you need to get some tests done? What happens when you need to get blood taken? The way that it works in my region is that if you need some blood taken, what they'll do is they'll maybe try to tack on a few extra little things, because the way that it works is you have a paper that you're given with a maximum of about, I believe, 5 tests with a maximum fee, copay fee of 30 euros about. Each test can cost between 5, 10, 15 euros. It depends on what needs to be done. But if you need to get multiple tests all done at the same time, you don't really have to worry about spending a few €100. Or like back in the States for the same services, potentially a few $100. However, for everything that we've talked about, all of the medical services, don't expect any of this to be in English. I'm not here to say whether the system is good or whether it's bad, whether it works or doesn't. This is just a brief overview of the way that it works, and personally, I've had no complaints. The only maybe minor complaint is just sometimes the waiting time can be a bit much. So like I mentioned at the beginning of this video, I've got some information for those of you who are looking for travel or expat kind of insurance to keep yourself covered while you're abroad for you or your gear. A couple months ago, somebody recommended to me worldnomads.com, and I took a look at it. It's not only just a website where you can get insurance for yourself, but it's also a great resource of information and where you can find out about different programs going on all around the world, and they've got all kinds of programs on there. So check the link down below. Also, to be completely upfront, this is not a sponsorship, but the link below is an affiliate link and does help out the channel. But anyway, if you have any questions or if you have any comments or whatever, as always, this is a completely open conversation. So if you have anything to say or ask, feel free to leave it down in the comments section below on YouTube, or you can always feel free to send me a private message over social media. And as always, I'm Rafael Di Furia, aka Rafi D is me, and I'm not your average gringo. I'll see y'all next time. Later. I just wanted to say a quick thanks for watching and subscribing, and if you enjoyed this video and you want to see more content like this, be sure to check out that video right over here.
I said you want to go do what to a what? Like, firstly, let's not use that sort of language. There's no need for language like that. Let's everything's okay.